name is Bethany Johnson. Today's date is June 11th, 2021. Today I will be discussing cardiology, specifically about the heart. I will be showing you some pictures courtesy of Visible Body with some diagrams on what part is what on the heart, and also be discussing a common disease or disorder that can be related to the heart. So first, I'm going to show you a picture here. And this is the epicardium. So there is 3 parts that make up the heart wall. And this is the outermost layer, and that is the epicardium right here. Almost kind of looks like a skin flap right here. The next one is the middle layer, and that is the myocardium, middle, and that is right here. And I kind of think that this kind of resembles like a chunk of steak or something. Kind of funny analogy to think about, but that is this right here, and that's the myocardium middle layer of the heart. Here's another section of, or another picture of the myocardium, just so you can kind of see in relation to, this is an up close kind of a 3D visual image, and then this is actually where at on the heart wall you can actually see it. So you can kind of see it right in the middle. I couldn't really get a good visual picture of the epicardium on the outside of this, so I just thought that this would probably be a good representation as well, that you can kind of see up a little bit closer of where the whole myocardium is in related to the heart wall. The last layer of the heart wall is the endocardium, and the endocardium is the innermost layer of the heart. So that's what's in the innermost section, and that is right here, this little flap right here. So you would have the epicardium like right alongside this edge. This was your myocardium, and then this is your endocardium right there. The next one we have is the inferior vena cava, and that is this little section right here. And if I kind of tilt this a little bit, you can kind of see that it's more of like a hollow right here. It's not just straight base. It is open on that bottom. So that is the inferior. And I'm going to keep this picture here so I can show you in relation to the next. And the next is the superior vena cava. So you can see right here, superior, right up here, and then inferior. So superior above, inferior below. So this is a good representation of what superior and inferior mean as well. And the next one is the atrium. So we have a left and the right atrium. This picture that I'm going to be showing you next is the right atrium. And that is this area right here. So if this was, if this heart, the section of this heart was kind of flipped, you could see the left on this side, but I will show you a different visual image for that. Just because of this is the angle that this picture is depicting. But this is actually the right atrium, and this is just this section right here, not these top parts, because that is something else, but just this whole little section right here, that is the right atrium. The next we have the tricuspid valve. Also, you can call it the right AC valve, but it's a lot easier, and I think you can memorize that a lot easier, is the tricuspid. And when I first visually see this, because I'm definitely a visual learner, I kind of thought that this kind of looked like a funnel that maybe you would run something down into. So this is the tricuspid, and you can kind of see it does have some areas where it does kind of extend off. So this is the right AC valve again, or the tricuspid. I like to call it the tricuspid because it kind of resembles like a cup. The next I have is the right ventricle. So we also have 2 ventricles. We have a left and right. This picture is the right, specifically the right. And this goes all the way up down here and comes right down here and all the way back up again. Then next we have pulmonary arteries. Pulmonary arteries are right here. A good one, picture of it. Oh, sorry. Can't even really see that. Pulmonary arteries. And then we have pulmonary veins. And pulmonary veins are 1, 2, 3, 4. You see those? Next one we have, I showed you the picture of the right atrium. This is now the left atrium. And so you can see that the right would have been on this side, and this is the left. And it is right in this section right here. Because remember, when we are anatomically looking at things, it's always the opposite view that we're looking at. So obviously we would know just right offhand anyways, unless you needed to, if you didn't memorize it prior. We know that you can tell that this is on the left side, and then this section is the atrium, so it's the left atrium. Next we have the mitral valve, or the left AC valve. But again, I think that the mitral valve resembles the tricuspid a little bit, because it does resemble a cup or like a funnel-like. The easiest way for me to remember that the mitral valve is on the opposite side, and it also has the tricuspid has more of the 3 kind of like prong things. I'm not sure exactly what it is, but kind of the prong things that kind of extend, and these are more all on one side. So that helps me remember that this is the mitral, not the tricuspid, but they are very, very similar. So I definitely could see that you could get really confused with that as well. So mitral, tricuspid. Then next, I showed you the right ventricle. This is the left ventricle. So remember the right, kind of extended all the way up here, and was a little section down here, and then over here. This is the left ventricle. So it's this section right here, and then all right in this area. Then we have the aortic semilular valves, and they are one right here, and then there's actually a little guy back here too. And those kind of remind me almost as like doorknobs. So aortic semilular valves. I think this one, everybody probably has heard of the aorta, major part of the heart, and definitely pretty simple to point out, right? This section right here, aorta. The next picture I think is very amusing to me, because it is your interventricular septum. And the easiest way for me to remember the interventricular septum is that it kind of looks like a septum, kind of looks like, actually kind of looks like a green bean from a garden, but for me to remember that it's your interventricular septum, I kind of think of it as kind of like a sword, like a septum, maybe like back in the olden days. So this is your interventricular septum. Next we have the chordae tendineae, I believe is how you pronounce it. And that is these guys that are extending off the tricuspid and the mitral valves right down here. So this again is your mitral valve with the chordae tendineae extending down, and then again on the tricuspid that also extending down the chordae tendineae. And the last picture that I will be showing is the papillary muscles, and that is right here. So we've got one little area up here, 2, 3, 4, and 5. So there's 5 papillary muscles, and that is also again attached to the ventricular walls on both sides of the heart, or in the inner sections of the heart. Excuse me. The next thing I will be sharing again is a common disorder or disease of the heart. And today I have chose to discuss coronary heart disease. I chose this because I think a lot of people have heard of coronary heart disease or have had a family member or a friend that has been attributed to this disorder, but doesn't really know exactly what it is or what it's made from, or how it happens, I should say. So again, coronary heart disease actually develops within the arteries of the heart, and what actually happens is that the heart cannot deliver enough oxygen-rich blood, and unfortunately is the leading cause of death within the United States. And I will get to why later on in this presentation. I will get to why coronary heart disease is actually the leading cause of death within the United States. So what does it do? Coronary heart disease is often caused by a buildup of plaque within the lining of the larger coronary arteries. The plaque can actually be partial buildup, or it can be completely block all of the blood flow of the large arteries of the heart. And so obviously we know if it completely blocks, that's when we have the heart attack. If it's partially blocking, we probably won't really have any signs and symptoms of any issues, and that is particularly the reason of why it's the leading cause of death within the United States, because it's kind of like the silent killer in the beginning until most of the time we don't even realize that we even have this unless we have consistent medical attention with blood tests, EKGs, and other types of medical interventions to make sure this doesn't happen. So like I said, you can either have it partial, or the plaque can either be partially or totally block the blood flow of our larger arteries of our heart, which in turn will eventually reduce the blood flow and may even cause chest pain, which in the medical field we call angina, and also can cause shortness of breath, and that would be called SOB for short. So those are just kind of some slight things of chest pain and shortness of breath that can be contributed, especially in the earlier stages of coronary heart disease. But again, very minute, because lots of people have chest pain, on and off for all sorts of things, and shortness of breath can be contributed to all sorts of things too. So one might not even recognize that there is a true underlying problem, which is very scary. And again, probably one of the leading reasons of why it is the leading cause of death within the United States. Coronary disease can be a couple different names called for it. Can also be called coronary heart disease, like I've been stating, coronary artery disease, or ischemic heart disease. So all three of these names mean entirely the same disease. So if you hear it called a certain type of thing, just know that it is all contributed to the same thing. There's just a couple different names for it. Typically, the first sign of coronary heart disease that an individual would normally have would be a heart attack. So again, very acute issue. We know that if we have a heart attack, we need medical attention very quickly, stat, as we call it in the medical field. Normally the first sign would be a heart attack, and small signs, before that, like I said, would be the angina or the shortness of breath. But again, can be contributed to other ailments, or, maybe you just worked out too hard, and you have some shortness of breath, or maybe you, did chest, lifted weights and your chest kind of hurts, just from muscle soreness. So sometimes we don't really think of those as being signs and symptoms. So basically the first one, we would be a heart attack. And now it's like, okay, it's a little too late, to really realize that we have a major issue happening within our heart and inside of us. So what can we do to stop this? How can we correct or try to not get coronary heart disease? Well, the easiest thing would be modifying our lifestyle. Look at how you're living your life. See what kind of changes are needed. And obviously medication when necessary, ordered by your physician. After tests are done, kind of see if medications are appropriate. So what kind of lifestyle changes am I talking about that should happen? Well, the easiest one that I think a lot of people need to choose is a healthier lifestyle of eating. And I'm not talking about sitting down, eating your greasy cheeseburger from McDonald's. Choose more fruits and vegetables, heart-healthy meats, better grains, things like that. And also exercise. Get up off your lazy butt and get outside at least 30 minutes a day, preferably 5 days a week, if not more. But get that heart flowing, so that plaque isn't building up. Choosing healthier foods, you're not going to have that grease that's clinging to those arteries. And again, losing weight. If you're overweight, you tend to gain a lot of weight if you're choosing non-healthier foods, and especially over-processed or greasy foods in general tend to be a little bit more overweight if you're going to be eating that consistently, in which we're talking about, because coronary heart disease is not going to just happen overnight. This is over a plethora of months, years of that plaque building up. Losing weight, definitely. And also the big one that I think is very hard for most people is to reduce your stress level. I know that for me, of being a mom of 3 kids and a full-time student, kind of hard sometimes. So I definitely want to try to eat healthy and exercise as much as possible, especially now since the sun is shining here in June. And another big one is if you're a smoker, you need to quit, because we all know that smoking is never good for our heart and lungs. Obviously, you never want to stop cold turkey. You want to seek medical advice and slow down that, and then finally quit. But by doing all of this lifestyle modifications, you will know that you will be promoting healthier arteries long term. I hope you enjoyed my presentation. Thank you very much.